Welcome to our inaugural series of Dr. Talks Percussion. We're here in Oahu, Hawaii. My name is Michael Carey with Fitness Evolution 808. We're going to talk about the use of a percussion massager for chronic issues that you may deal with or somebody that you know, a loved one, may deal with as well. We're going to be talking about the different accessory heads as well as how to use them on your body. You may have a different percussion device, but just try to use what you have available and get the same kind of effects that we're hoping to give you today. And Doc?
Aloha, my name is Dr. Kai Moriguara with Prime PT Wellness Clinic here in Kaneohe, Hawaii. Okay, so for our sciatica, we have the nerve, so that's where we're following the nerve pathway, and that's where we want all those tight muscles to loosen up so it's not pinching on the nerve. We just follow down. So that's where sciatica is nerve pinching in the low back, and it can range from any level of radiating, shooting pain down to the glutes, hamstring, calf, or even into the feet. So because we need quite a bit of penetration, we're going to be working with our wedge attachment first. So same thing, we're going to test the waters. And we're looking for these sensitive spots. As they loosen up, as we get more blood flow, we can steadily increase the pressure, as well as increasing the speed. So steady increase in pressure to get all these tight muscles and fascia to loosen up. That restriction alleviating is what allows for the increased blood flow. So great visualization is a kink hose getting unpinched, and now we have all that circulation. We're going to switch over to our flathead with nodules. So nodules do allow for further penetration. So that's where this is a progression from what we just did with the wedge. So on the exact same speed, we're able to penetrate deeper and promote more of that healing process.